and welcome to the CCC News Podcast. I'm here today with some folks from the Community Hub in White Salmon, Washington. Guys, hello. Hello. Will you introduce yourselves for me so I don't get everybody's name wrong? I'm just kidding. No, why do you go first?
I guess I got pointed to me.
Oh, there you go. I'm sorry. Come on, go first.
That happens every time. So my name is Juan Reyes. I am the Associate Director for Washington Gorge Action Programs. And
I'm Rita Pinchot. I'm a mental health therapist with the ESD 112 who's at the Hub.
My name is Kay Alton. I'm a private practice therapist in Oregon and Washington, but I also supported Washington Therapist Collective being started, which is at the Hub.
Cool. Welcome to the podcast. This is so cool.
thank you for having us.
Yeah. So to go back, you guys, we had a grand opening about 2 months ago now, about maybe a month, 6 weeks or so ago.
2 months ago.
In White Salmon. It was the old, it was a comprehensive healthcare building, and now you guys have moved in. And it's collaborative, it's new, it's not something the White Salmon has seen before. What is it?
Yeah, well,
Great
I don't
question.
know. Yeah, I think one way that I personally like to describe it is an example of what can happen when community and community organizations come together to provide a need that the community is asking for. So the Hub is a great example of that. We also have the next door in there, and what was it?
Perinatal.
Mental health task force.
Yeah, as well, that is joining the Hub, and we're able to provide these amazing resources and services to the community.
That's cool. So it's a bit like the Gloria Center in the Dalles, where like lots of different agencies are together in one place. And so like if someone comes with one need, but they actually have two, then you guys can work together. Is that what it's like?
Mm-hmm. Yeah, that's the goal. I think the Hub is truly a collaborative effort that we and many others were part of to address a need in our community related to mental health services, but also just a need for increased connection amongst ourselves as providers, but also between ourselves and the people we're hoping to reach out to and support.
That's cool.
Yeah, I mean, just to back up a little bit, I mean, that space that we're in is right across from Harvest Market, if people know White Salmon, and it's this building that takes up a big space in the community that's been empty for a long time. And, there was a grant that was written through Paul Lindbergh and Claire Rawson, Hat Creek Consulting, right?
Yeah.
Thank you.
Yeah.
And they got this funding through Southwest Washington Accountable Communities for Health, WASH
cool.
funding. So it's 2 years for us to get our feet underneath us. And so we're definitely still in the muck of figuring out what exactly the space is, who exactly is going to be there. And I think the three of us that are at this table have been just huge cheerleaders. And Rita and I in particular have been wanting to use this space for 6 years plus, right? So I think in some ways...
6, 8, 4, 12, who knows? A long time.
Right. So, I think it's also like a bunch of dreaming that's coming into fruition. And so I think we're still like, pinch us, is this really happening? Do we really get a chance at this? Because we're figuring it out, like the policies and who waters the plants. Apparently it's Rita for now, right?
Fridays.
Like who's gonna clean the bathroom if we don't have a custodian? Like pick up after yourself. Like we're literally like, it's a living room. Like we're kind of like roommates where we're figuring out the rules. And we're having monthly meetings, every other week meetings right now to figure out all of those details. And thank goodness we have Paul and Claire who can help us with kind of the sustainability model of it, right, in the long term. But it's a process.
Yeah, a big learning process. But, we're very fortunate to have other organizations, as you mentioned, the Gloria Center, that we can definitely try to emulate or learn a lot of lessons that they've gone through in collaboration and what's worked, what hasn't worked. Yeah. And so part of the policy work has been just asking questions with a lot of the agencies that are very similar to the work that we're doing and trying to figure out what works best for us and what works best for the community and how that can optimize the services that are going out the door.
Yeah.
I think just... one of the things that stands out to me, and I know I've shared this with the group before, but when the Hub first started and we first came into that space and we were talking about what the space was going to look like, what it was going to feel like, I remember how powerful it was to watch community members that have been in that space beforehand and the hope that was coming out of that. And just that word hope kept coming out every single time. And to see it now and where it is and just how it feels when you walk in through the door, how much lighter it feels, and just the energy that all the agencies bring to this project is just so spectacular to watch. And I'm so excited to see it just continue to grow. And, even just coming up with the name, right? That was a big example of what happens in collaboration. It takes a little bit longer, but I'm hoping that name represents really what is going to be happening. So it's Community Roots Wellness Hub.
Community Roots Wellness Hub.
Ooh, Community Roots Wellness Hub.
We're working on a logo, so if anybody has any great logo ideas, send them to Juan.
And it sounds almost kind of like a unique challenge because, like on one side, you got Wild Gap who offer like a certain set of things to their clients and the people they serve, and like therapists and like kind of school level therapists are offering different things too. And so you're meeting different clients with different needs and collaborating together in the same space. So the space is bringing you together, but it sounds like there's a new challenge of like working together too, right? Sharing space is one thing, right?
Yeah, I'm just thinking as you're talking, like just the really beautiful and sometimes frustrating challenge of taking a dream and then like putting it into a policy. Like that is not sexy at all. Or particularly fun, but like somehow it manages to be with our team because I think we try to remember why we're there, like as part of our practice. Like we have a vibe committee that's like our job is to like keep the vibes positive. And, I think we just met this morning, even we're talking like, let's make sure we continue to focus on the positive connections between us as we're going through the like blah of like our mission statement and whose email and like these things that, weren't really part of like the big dream, but are really important to keep it moving forward.
Yeah, policies are hard. Yeah, for sure. Especially in startup business. And when you've got like a startup business with a single founder and a single set of kind of clients that they're reaching, it's much easier, right? You don't have a whole giant list of unknowns. You have just a few, and you try and deal, make sure that you're treating people equally by using policy, right? But with so many different agencies operating so many different levels, I can imagine that being a much harder task than a startup business, like this one might be.
And it is pretty cool. Like before we started, like ESD 112, what Rita works in schools normally, right? Yeah. And so this is new for them to be in outside of schools. And like as a therapist in White Salmon, we have therapists at like One Community Health. That's like a integrated model, right? Where therapists are with doctors in a clinical situation. And then we have people more in isolation and private practice, and there's nothing else, right? So this is kind of an opportunity that's not community mental health in the way that it's offered currently, but, it's kind of like a good in-between where people don't have to be in their caves. Therapists aren't just like alone in the world, but can show up, right? And it also just makes so much sense. Like WAGAP has provided mental health services for their staff and for their clients, right? And so it's like perfect that they're right here so close in this initiative because it's obviously a priority to that organization, to your organization, Juan.
Yeah, no, and we're incredibly proud to be a part of this project. Our community health workers are there and they're meeting with clients also, and it's been a really great space for them also to be able to connect with therapists that they might not have known about before and the services that you guys provide. And I've heard from all of them that that's just been so amazing for them to even know about that, so that if they have clients that need those services, they know exactly how to refer. And, once we work out those procedures, it'll be a lot more streamlined. But again, it's all those things those growing pains that are happening as things are progressing. But yeah, no, I think, as like you mentioned, as the agency that's providing a lot of these different resources, I know with those resources, it gives us a lot of really good opportunities to connect with a lot of different individuals and organizations that are providing different resources and services in the community. So this is just kind of bringing it to the forefront. And as Kay was talking about, I think one of the things that happens a lot in nonprofit work is people start working in silos, right? They're focused specifically on the services that they're providing. So the hub is a great example of getting out of those silos and to be able to come together and figure out how we can provide those needs that the community is specifically asking us for that haven't been met before.
Yeah. And that's an interesting question in itself in terms of those needs that you guys are speaking of, from the point of view of those specific needs, but also from a point of view of location, right? We've got this cute little town, right? White Salmon. We've got 5,000 people-ish in White Salmon. It's the very most west end of the county, where the main county services are an hour away by car, unless if you have a car. There's almost no public transportation to Goldendale. Not quite none. There is Mountain Ellis Transportation, and they run a service about 4 times a day, I believe, back and forth. But that's going to take a full day, right? Most of us that go to work don't have a full day to go visit the therapist in Goldendale, right? Because of work or children or both. And so tell me about that. Like, it sounds like you guys really heard about the needs and you're really trying to meet those with this. Do you have a good clear picture of what they were and some of the surrounding picture of the location?
Yeah, and I would say from the WAGAP side, when we did our community needs assessment, individuals that responded to the survey, what we were looking at is about 20 to 30% of the community was saying that they needed some kind of services or didn't have access to some kind of mental health services in the community. I know that in the past we have partnered with Kay, and I believe that's happening right now, where we were able to find a grant to be able to provide a sliding scale, right, to community members so they can have more access to that. So I think the hub was just another step in that direction to be able to provide what the community was asking for. One of the other big pieces they asked for is community connections, which is, coming together as a community, whether through events, locations, or just a space where people can come and be there in community and be there to support each other. So I think the hub is allowed for that with a lot of the other programs that have had meetings there. I think there's some family nights or family support groups that are there.
Yeah. I think another group that I represent is the Perinatal Mental Health Task Force. And so we, as soon as the hub opened, we're able to restart our parent support groups for parents in that perinatal period with kids 0 to 2 on Friday mornings at 11. And that's just been, we've had a full group, right out the gate. Like, we knew there was a need for that. For that group, we know there's a need for increased support for that population in particular. And then switching hats back to the ESD 112 role, we have therapists in the schools in Klickitat County. Each school has either a floating therapist that is going in 1 to 3 days a week, depends on the school and the need. But they're really, if their caseloads get full, and then if there was a need for whatever reason to have like a community-based referral, there just wasn't options for a long time. And so knowing that, I think, helped motivate not just myself, but the leadership at the ESD to kind of support this initiative in a way that I think, maybe feels a little bumpy for them, but they've been willing to give it a try.
That's cool.
Yeah.
Yeah, and we've been, so my private practice is Alton Counseling and Consulting, and I've partnered with WAGAP in order to apply for grants, and we were so lucky to get grants through United Way, and the Deborah Ann Angel Fund was another one, and I'm looking to get another one from Skyline Foundation to try to increase services, because federal cuts have really affected how much mental health services WAGAP has been able to provide, including programs for peaceful living, which is the program that supports survivors of domestic and sexual abuse. So their funds for domestic abuse survivors has completely been exhausted. And so trying to increase fundraising, but also some of the work that Washington Therapist Collective does with these meetings is also trying to figure out the barriers for therapists accepting Medicaid, because that's one of the biggest problems, right? It's like, there's like 2 providers, including myself, in Klickitat County that accept Medicaid through Community Health Plan in Washington, and it's because of the reimbursement rates. So I always like to give a plug, because a lot of people don't know this, but In Oregon, the Medicaid reimbursement rates are almost twice as much as they are in Washington. So a lot of therapists will get trained in Washington, but then go and do private practice in Oregon. So trying to negotiate rates, looking at a group practice model, that's what we need to do in order to have more community-based therapist options, because one community health in White Salmon right now, I called last week and they had a 2-month wait. And so that's, I think, right, really like the only other option right now in the county.
And KVH too, I will say,
KVH and
you know,
Goldendale.
it's,
Do they have,
they have
therapist?
a long wait list. I don't know what it is, but we've been able to build a partnership with our juvenile department to get some kids there down to the hub for services. They, and that's more specific to youth who maybe need co-occurring services, specific to mental health and substance use, or, you know, there's more of like urgency around it. And that's been a huge gap, I think, in that community as well. And so it's really nice to see, you know, other partners who maybe aren't involved in the hub still being able to find ways to get creative with us and increase access to not just kids in White Salmon, but in the outlying communities too, because I think that's really important to all of us. And it's something that's been really beneficial, at least for me, having the community building opportunities with the community health workers, like being in the office space together day after day. I just like understand better who does what and what's possible to support youth and their families.
I mean, this challenge is we're in a rural place, right?
Yeah.
And so the more rural we even White Salmon being, you know, the bustling metropolis that it is, right? I'm so glad that this is happening here, but there's a lot of people to serve, right? And like they're across the county, you know, we're in one of the largest counties.
It's the size of Rhode Island. Clickett County is the size of Rhode Island.
It's huge, yeah. If you've ever driven east, you can drive in Clickett County for like 2.5 hours before you get to the line, you know, and you drink a lot of wine on the way too. Not not while you're driving, obviously, but there's some great wine out there on the east side. It's great. But yeah, these issues are not limited to Washington, right? Like there's some, like the Oregon rates are higher, but there's still barriers to having enough therapists and getting enough mental health services to organizations across the board, right? And so having lower rates is a big barrier, right? You know, when there's a high demand and on the Oregon side too, that's not helpful, right?
Yeah, and the space is really important. Like I have been able to see clients in Goldendale through WAGAP's space in Goldendale, which has been awesome. And then the hub is also a physical space. Like office space is really expensive in White Salmon, right? Like that's one of the problems is housing and rent. And so that's a huge resource, is just having space.
And you definitely want to be in person. I mean, especially for young people too, right? It's not like it's just the Zoom doesn't only works for adults that like who are been to therapy a little bit longer, right? And they get it, right? And we've been through it. And like I'm good on Zoom with my therapist now, but it wasn't at the beginning, right? It took a long time to get to the point where I could get out of therapy that I needed on Zoom, right? It wasn't initial.
Right.
It took meeting in person to get that, right?
Like we're working with kids. Brooke
even
Jefferson,
harder
the other
with
therapist,
kids.
and her and I work a lot with teens. And so you're right. If they have a choice, they will always pick in person.
Yeah, and it's that trust building with kids, right? And like that's limited to therapy too, right? That's you know, when you go into school, you don't get anywhere with kids until you build rapport and you build trust with them, right? And you do that in person, don't you?
That's right.
So having that space is super critical. And I can imagine if you only have 3 or 4 clients in Goldendale, it's really hard to justify building, you know, a clinic and having a rental space out there and having the overhead, especially if you're on, you know, you're taking the medical, you know, the medical insurance plans for sure as well. So I see that this is the complicated picture, right? It's a big old complicated picture.
Yeah, we have a beautiful conference room too for doing groups, and I think that acknowledging how great groups are.
Yeah,
and I always like to say that because we talk about mental health and people think of one-on-ones, but like there's also so much opportunity for bringing families together. We have a small conference room, but also big
You have a really nice conference room. Yeah, it's got a big window, and you see the sun going down, and you see the mountain, and the store's just right there if you need a snack or something.
across the street.
You just run across the street. They've got hot wings. You got anything. It's great. It's got everything you need. It's perfect. Yeah.
This podcast is sponsored by Harvest
Harvest
Market.
I will be calling them now. Thank you. This is great. So where are we going from here? I mean, it sounds like you're building policies and working out how to work together. We talked about some of that already. But where are we going from here?
Yeah, I think one of the things that we were just talking about earlier was trying to figure out exactly who's going to be in the space. We have some amazing community partners, the agencies that we talked about, but there's still room for growth. There's still some spaces in there where organizations can come in there and we can try to figure out if it fits the mission or the vision of the project that we have, and hopefully expand the services that the hub is providing right now. And I foresee it just, being an ever-changing thing, right? There might be another need that the community needs that we might be able to house at the hub, and that would be amazing. One of the other cool parts about working in collaboration is, as you were talking about funding, is we're not competing for the same kind of funding, right? And instead, we're supporting each other on a project, right, to be able to accomplish that goal. Yeah. And that's been amazing to watch. And this is just a personification of what that looks like. And I'd love to see this model emulated in other counties, other locations. Like you said, it's rural, and I know that a lot of times people talk about like big cities, and it's just easier to get funding from there. And when we're talking to funders and grants, they see this different perspective of this big metropolis that has a lot of people providing services. But when they really come down to our rural areas, they see all the amazing work that's happening and how inventive everybody is to be able to provide those things that typically wouldn't happen. And that's been really cool to watch, is as they're coming and visiting, they're starting to see wow, you guys pull that off with this little bit of funding. It's yeah, because we know that it's a necessity, and we will work together in collaboration to make it happen. And that is very unique for rural communities, is we are working together all the time. And, this is to have the opportunity to actually, like you said, bring this goal and this dream to physically be there is just, it's awesome to be a part of that.
Cool. Okay.
We were talking about maybe having a baby shower
For the hub.
Oh,
You?
We need some couches.
Okay.
We need some
the
plants.
vibe committee.
We'll register items for
Yes.
the hub baby.
Okay.
But no, I mean, in all seriousness, it is, starting to shift to I think we're all very committed to making sure that this is sustainable and continues to exist. We got this initial funding, but how do it's so important to keep this going. And this is such a unique solution. We had one of our state representatives, Representative Stu B, came to our open house and said he was there because it was the first time a group has come to him with a solution instead of a problem. And that really resonated with me. And I think many of us just thinking that's a big deal. This is a solution to a problem that lots of communities are facing, especially rural communities. And so no pressure, but we've got to make sure this is sustainable and honor the work of other groups that we're kind of following and learning from, and also, support our community along the way. And so, yeah, that's kind of where we're at.
It's hard to take something that didn't start with a revenue model and add a revenue model to it afterwards, It's tricky. Yeah, most businesses are built the other way, right?
Right.
Yeah.
Yeah. I mean, in the planning, before we were even in the building, there was a little bit of who would show up with rent if we need to, because nice. If Paul and Claire can get us another 2-year grant, amazing. But also we can pitch in. The rent's not that much. This is what it takes to continue to be collaborative, right? Or
And when you've got the on-ramp web and all that other stuff,
Right.
it's that kind of startup thing that's so hard to do, and then you're doing, right?
you're doing it.
So, yeah, continuation a little easier.
Yeah.
Not fast, but a little bit.
Well, we're really hoping that the community will continue to support the hub. Even just the cleanup day that we did, community members came together to be able to do that. I mean, cleaning up the yard, painting, pressure washing, like all those other things. We had a community member that was walking by and he's like, what's going on? And he just like stuck around for a few hours and helped us do some weed pulling and yard work. So really, I hope that that continues happening as the hub is progressing. We're talking about a mural on the outside of the building to really represent the history of the building, because it's been, what do we say, the ice cream parlor, laundromat, what was like a burger shop, I think? Or was that part of the
Thrift store is on the timeline somewhere, and a burger palace or something, I think.
Yeah,
is that?
Palace. It was a palace.
That maybe was the name. I don't know.
But there was a burger palace. They putting cheese on them burgers.
Yeah.
Yeah, but again, hopefully, that mural again representing the community, and so we're hoping that the community will continue to be there for it and see the value of it, and that it will be there for a really long time.
That's great.
Yeah, and people can't, like we are these agencies that are kind of in the leadership positions around like some of the foundational stuff, but like part of our mission is to like anybody who's aligned in mental health world stuff, we're doing things that are good for the community, like wanting folks to be able to also use the space. Like we want it to be used, right? We feel like before it was underutilized and closed doors. And yes, right now we're still looking to hire a front desk person and developing the job description so that we can leave the door unlocked, right? And have it feel more inclusive in that way. But that is the goal, is that we want it to be used for folks who, and some folks maybe would be happy to pay a little bit to support our mission and use it like they would a community center, and then other folks who can't, like, that's a different situation. But like, it's just, again, it's like, come and use it. Like, how, people are like, how can I use it? And I was like, okay, let's count the ways, right? Like, we're going to have a menu and we want it to be clear. We don't want it to be muddled. So
if you have a group and you're looking for somewhere to do it, to do the group, and it's positive community or health-based or support, support-based,
right? Yeah,
they should come to you guys.
Yeah,
right?
like if a therapist wanted to do I don't know, like an anger group and wanted to, as a way of giving back to the community, like, great, let's give a proposal in there and figure out a way of moving forward, right?
Cool.
Like that kind of thing.
That's cool. What else?
Yeah, well, I mean, if somebody wanted to do a podcast out there, we could do it that way.
I'm listening.
I mean, we're very intentional in the space, especially the conference room, on how flexible we were for the use of that space. So even the tables, they fold, you can put them away, and then that way you can just open it. Yeah, you can do yoga.
Dance.
Actually, they have yoga.
Doing more movement. We're talking about doing a dance class up there.
Yeah, it's just, the sky's the limits. And and again, another way of showing and being there for the community. And so, they can just reach out to us. And
I think the hub has a drop down on the WAGAP website, right?
Yes, they do.
So people can donate, and then if we had a pool of funds that we could continue to offer free classes on an ongoing basis, like that would be a dream. Like we're planning, we have funds. Washington Therapist Collective has funds for doing 2 groups in the winter.
Okay.
But like if we had other funding, we could be more creative around what we offer, which would be great.
Cool. So if you're a partner program and you have some inclination of doing something different in the future, or growing your program, or adding a new group, or looking for other places to collaborate and have hubby type things, then you should reach out to you guys. Go to wagap.org, and then there's a drop down called Community Hub on there, right?
Yeah, Community Roots.
Community Roots,
we
thank
also
you.
just got a Community Roots email, which is communityroots@wagap.org, or they can just call the WAGAP office if they have any questions, and we can connect them with the right person.
Great. Well, fantastic. Thanks so much for coming in, you guys.
No problem.
Thank you.
Great.
Thank you so much. It's so cool.
Did we miss anything? Did we forget anything before we left? I'd like to ask
A
this.
little plug for the Washington Therapist Collective. Next meeting is December 18th
December 18th.
at the Garage in Bingen, if any therapists want to join.
Okay, any therapists needing therapist community,
Interesting
come down,
show.
Washington Therapist Collective. Thank you. Very helpful.
And we really are going to have a baby shower, so stay
really are.
tuned.
Yeah.
And if you have a couch that's nice and it doesn't have bed bugs,
Don't just drop it off, though.
then let us know so we can put it in. Well, thanks for coming. I really urge everyone to reach out and find out what's going on. You guys are gonna have a website soon, I think, or
I hope so.
maybe
Yeah, in the works
in
eventually.
the works.
Yeah.
So yeah, stay tuned. There's also a story about this in CCC News. You can type in White Salmon Community Hub and it'll come right up.
Yay.
And it's great to have you on the podcast. Thanks so much.
Thank you
Thank
so
you
much,
so much.
Robin.
you.
Great.
Yay.
Thanks everyone. Take care and we'll see you soon.